Hello, everyone. This is Rebecca Gaydon, Senior Principal of Capital Equipment Solutions at Vizient, introducing this exciting new podcast, The Capital Compass. On The Capital Compass, we help you navigate your journey to value. You'll dive into the most dynamic and surging areas in healthcare spend management, from diagnostic imaging to group buys and everything in between. Now, stay tuned to enjoy the podcast and be sure to subscribe to The Capital Compass and not miss a single episode.
Welcome back to The Capital Compass, the podcast to help navigate your journey to value. I'm your host, Andrew Rebhan, Senior Consulting Director for Sg2 Intelligence at Vizient. And today, we continue our foray into diagnostic imaging. Joining me again are Adam Fairbourn, Senior Director of Contract Services with Vizient's Capital Equipment Solutions, and Gurmeet Bawa, Consulting Director with Sg2 Intelligence. Adam, I'll start with you. As imaging volumes continue to climb, so do concerns about its environmental impact, from energy use to helium consumption. So what does green radiology look like in practice, and how are providers incorporating sustainability into their capital equipment strategies?
Sustainability in imaging continues to be a topic that Vizient members and imaging leaders on our contracting councils have a growing interest in. Alongside several of our hospital members and industry leaders and other stakeholders, Vizient was a part of the creation of the Medical Equipment Proactive Alliance, or MEPA, for sustainable criteria for medical imaging equipment. This landmark work focused on purchase criteria for imaging equipment such as use of harmful chemicals, sustainable corporate practices, recycling or conservation of resources, energy savings, and reducing carbon emissions. While supplier selection is important, our imaging leaders are also focused on how equipment design and functions can reduce energy consumption or waste. When you look at the amount of energy large imaging systems are using, it begins to make sense that there's a lot of room for improvement in reducing consumption and waste from a design and an operational perspective.
Now, beyond just purchasing energy-efficient machines, what operational practices can help these imaging departments to reduce that waste and energy use? Is this actually saving us money?
We are certainly seeing our imaging suppliers design systems that are more energy efficient, which is excellent. Often more advanced imaging systems can require more energy to perform at an advanced level, and suppliers are incorporating mechanisms into the design that allow operational practices like powering down non-emergent MRI machines at night or during slow hours without the long ramp-up time that is typically needed to get things started again. Additionally, suppliers are offering more modular systems that can be upgraded in the field versus a forklift out and total replacement. That can be done when needed to reduce excessive use of energy and construction and materials. From a cost savings perspective, this is one of the challenges that imaging leaders are having in this space. While a lot of the savings tend to be soft dollars, when you look at the big picture and the goals of the organization, the cost avoidance can be pretty significant in these initiatives. Even a break-even point with some cost avoidance is a win in this space when you consider how many healthcare organizations have system-wide goals around sustainability.
Super interesting, Adam. Now, with radiologist and technologist shortages continuing, innovation is starting to step in here. We're seeing remote scanning, we're seeing smarter workflows, we're definitely seeing the influence of AI tools. What are some of the most promising strategies for addressing radiology workforce shortages, and how viable are they for systems of different sizes? Why don't we start with Adam, and then we'll see what Gurmeet wants to add.
Workforce is a big topic for the diagnostic imaging community, Andrew. That's big institutions, large or small. Any size institution is concerned with workforce and radiology. As an industry, the diagnostic imaging profession sits at the intersection of an aging workforce, a limited pipeline of new graduates, and you couple that with growing demand for imaging services across multiple sites of care. This is certainly a troubling combination for continuity of patient care if not properly addressed. There's a need for both short-term solutions and long-term strategies at this point. In the near term, the most promising strategy is to embrace and leverage innovations like remote scanning, automated workflows, digital tools. Not only can this enhance patient throughput and upskill early career technologists, it's also a recruiting and staff retention strategy. Digital tools and remote scanning offer radiology departments of any size the opportunity to have senior technologists take on more of a leadership role where their expertise is spread across multiple sites, simultaneously also leveling the skill set of newer technologists with automated workflows that provide instant feedback or auto corrections, almost like a self-training program. While this kind of innovation is certainly needed in the near term, the diagnostic imaging community is really coming together to bolster the future of our workforce in the long term. This is done by partnering together to advocate for education programs, career pathways, and really focusing on the next generation of staff. There's going to be a lot of openings for us to fill, and we'll need to think about how we educate, prepare, and really build a pipeline of talent ready to meet the demand and rapid pace of innovation.
Gurmeet, do you want to add anything on that?
Yes, I wanted to echo Adam with the importance of recruitment and retention. Those are very important strategies to have in place at any organization. In terms of workforce, the radiology workforce shortage, it's definitely been a huge issue, and it's been covered at last year's RSNA conference. Adam and I had the opportunity to give a presentation at RSNA last December, and we actually surveyed attendees on what was top of mind for them, and we found that close to 70% of respondents in the room chose staffing challenges as their main focus. So this is definitely not anything that's going away anytime soon. It's just very important to note that radiology shortage is not only limited to radiologists, but also includes radiology technicians.
Totally agree, Gurmeet. This is top of mind, and a lot of our providers are hyper-focused on solving for this.
Now, there's another big topic that they're going to be hyper-focused on, and that's AI and imaging. But more importantly, they're starting to focus more on governance. How are health systems balancing matters of innovation with quality and safety as they start to deploy these tools?
For many years now, artificial intelligence has been one of the hottest trends in radiology. Following the introduction of digital PACS, radiology sits on a mountain of uniform and standardized image data. It's perfect for AI innovation. That, coupled with the time-sensitive nature of the work that we have, it's no surprise that radiology leads the way in healthcare when it comes to adoption of AI. In fact, 3/4 of FDA-approved AI algorithms are radiology-specific. We really consider there to be two main types of AI-driven algorithms or automation that we see in radiology. That's passively adopted AI, or AI that's always on, low risk, and pretty much optional. So think auto-rotation application for images that need to be turned to the correct anatomical orientation. And then there's actively adopted AI, AI that needs to be actively selected and turned on with the confidence of the clinician. We mostly see actively adopted AI used for aiding in image interpretation by radiologists. Right now, the biggest question mark for adoption of AI in radiology is how reimbursement from payers will be handled. This is still very much unknown. However, the adoption of AI in radiology is still rising regardless. So with adoption on the rise and reimbursement in limbo, providers are standing up governance committees to assess how AI is acquired, implemented, and most importantly, how the return on investment is measured. We see organizations approaching this in various ways, and Gurmeet and I have reviewed a few examples that we like to share with our clients. Right, Gurmeet?
Yes, Adam. I think one of these examples comes from RSNA. There was a fantastic presentation from a radiologist based in New Zealand, and it highlighted his organization's adoption of AI. What was very interesting was how they evaluated the use of AI through certain success metrics, which included read time, radiologist turnover, agreement rate, and patient satisfaction. Overall, they found a 15% reduction in read time and increased radiologist to AI agreement rates when AI was adopted. That was really interesting. We do see rising adoption of AI. According to results from a 2023 workforce survey from the American College of Radiology and Radiology Business Management Association, around 50% of the respondents indicated using some form of AI in their practices in 2023 versus 42% in 2022. So that's around an 8% increase. The growth in clinical use spanned neuroimaging, thoracic, emergency, general radiology, cardiovascular, as well as musculoskeletal. And then growth in non-clinical use, that spanned clinical productivity, billing and coding, exam assignments, and prior authorization.
Super interesting, you guys. AI definitely is a fast-moving space, and we know that imaging already has a pretty strong foothold in that space. So interesting to track those trends. Now let's go ahead and pivot to talk about access. I think it's safe to say regarding access to advanced imaging, we still have a lot of room for improvement. Think about rural communities, underserved populations, and safety net hospitals that are still often lagging behind others. So Gurmeet, if I go back to you, how are mobile imaging units, smaller equipment footprints, and modular designs helping to close some of those access gaps?
When we're looking at mobile imaging technologies, they're increasingly being integrated into a wide range of screening programs. And this includes breast cancer, lung cancer, cardiovascular, as well as osteoporosis, and even more. These mobile imaging technologies, they're really positively reshaping screening programs. What they're doing is that they're increasing accessibility. They're improving patient engagement. By having these mobile imaging technologies being brought to the patient doesn't need to travel to the hospital. The burden of travel is eliminated. Definitely they're going to be more willing to go and to get screened. This is actually, these mobile imaging technologies, they're enabling earlier detection as well as enhancing the overall effectiveness of public health initiatives. So a lot of great stuff there.
Great points, Gurmeet. Patient access to imaging technology continues to be unequal. We see this pattern in Vizient's Vulnerability Index that is publicly available. However, healthcare systems are increasingly leveraging mobile and modular imaging solutions to increase access. This is important for screening programs and preventative care, but it's also amazing the level of technology that can now be brought to underserved areas. When you think of advanced cardiac care in certain areas of the country where patients may have to travel great distances, take time off work, and in some cases, maybe even pay more for parking than they do for their copay, all to get access to something like an advanced CT exam, that's just crazy. It's no wonder these patients are less likely to receive the level of care required for some of these advanced diseases. To think that now we have the advanced technology that can economically be placed in mobile or modular settings and maybe cut common patient barriers in half or better, that's an amazing advancement.
Definitely. Now you're talking about matters of access, but it overlaps with this other concept of health equity. Can you share any examples of how capital planning is directly supporting health equity, whether it's through equipment upgrades or site expansion or inclusive tech design?
Yeah, Andrew, capital planning is critical to healthcare systems' mission, and this is definitely true for equity and patient access to technology. You really have to start with intelligence about your market. What are the prevalent disease states in your market that you need to address? What technology do you need to answer the clinical questions? And finally, how are you going to execute a feasible technology lifecycle and placement plan to support this strategy? Historically, we've seen providers operate under what we would consider a like-for-like replacement. That is, capital planning to simply replace what you have today or just add new technology ad hoc. In today's shifting landscape, this approach just doesn't work. You have to build a plan that addresses equity and access to right-fit technology, whether it's expanding sites of care where procedures are offered or ensuring patients of certain mobility and habitus conditions aren't excluded from access, or even common cultural dynamics in your market. You have to proactively build access and equity into your capital planning. The good news is there's many options and innovations that are available to help, such as digital tools, modular upgrades, and technology that's constantly pushing the outer limits of image quality and patient access.
Now, capital planning isn't just about what to buy. It's about governance, data, and advocacy. What does strategic data-enabled imaging planning look like today? How are organizations getting smarter about aligning their tech acquisition with long-term value?
At Vizient, data-driven planning is of top importance to us and our clients. We've witnessed somewhat of a revolution towards data-driven capital and technology planning that focuses on long-term value and in many cases even going beyond total cost of ownership or life cycle, but thinking about total picture to provide ongoing services. The level of sophistication we're seeing some providers double down on in this space is pretty impressive. When you start with market intelligence, coupled with a live dashboard of equipment fleet analytics with insights around asset mix and spend performance, providers are truly looking at future planning that goes well beyond cost of acquisition. Now we're looking at performance improvement metrics, total cost of ownership, but then taking that one step further to planned replacement or addition of appropriate technology for clinical and operational goals. And this is moving to more of a total cost to serve outlook. This process is truly data-driven and brings a new level of clarity to best serve clinical and administrative leaders' objectives. Who benefits the most? The patient,
Right.
Which is always the focus.
Anything to add to that, Gurmeet?
I couldn't agree with you more. You start with the current capacity and utilization. Once you have that baseline assessment performed, then you can layer on growth opportunities, which will inform future investment in either new or replaced equipment. A couple of SG2 tools that come to mind, which can help inform decision-making at this stage, include number one, our impact of change forecast, which can help identify outpatient procedure growth opportunities across various disease states. Number two, our share of care solution, which can help inform market share across outpatient sites of care.
Now, from reimbursement to regulation, what advocacy efforts should imaging leaders and executives keep an eye on for the rest of 2025? Why don't we start with you again, Gurmeet, and see what Adam has to add afterwards?
From a reimbursement perspective, we continue to see downward pressure for most areas of radiology. In the 2025 Medicare Physician Fee Schedule final rule, there's a 2% decline in interventional radiology, while other fields remain neutral. However, there are areas of increased reimbursement specific to the 2025 Hospital Outpatient Prospective Payment System final rule. There's a significant increase in Medicare reimbursement for coronary computed tomography angiography, or CCTA, more than doubling the payment for the procedure. CMS has also finalized the proposal to pay separately for diagnostic radiopharmaceuticals with per-day costs above a threshold of $630. That's about 2 times the volume-weighted average cost amount currently associated with diagnostic radiopharmaceuticals. So this is kind of interesting to see these developments from a reimbursement perspective.
Yeah, totally agree with Gurmeet's downward reimbursement pressure in the aggregate has been the norm for many years. That said, the diagnostic imaging community has a big voice when we're all together, and our patients are counting on us. So from an advocacy perspective in 2025, I would urge imaging leaders to look for opportunities to engage with peers and professional societies around bolstering workforce initiatives, advancing innovation in the U.S. market, and supporting patient access to technology and treatments, especially in oncology, cardiology, and neurology areas.
Well, guys, one thing I'm gathering from this conversation is that imaging is moving fast, technologically, geographically, strategically. So as we look ahead, what excites you the most about the future of imaging from a provider perspective? Where do you see the biggest opportunities to drive clinical and financial return on investment?
What I'm most excited about from a provider perspective is the rapid innovations we see year in and year out in the radiology space. When I think about where we are with image quality and scan time, it's hard to believe how much this has changed and continues to change from when I started out as a nuclear medicine technologist doing cardiac spec studies that took 25 plus minutes per scan. The innovation is exciting, but where I see the biggest opportunity is the data-driven insights that are now available to ensure that your organization maximizes return on investment for these technological innovations clinically, operationally, and sustainably. Imaging is a complex category for a healthcare system, but it can also represent the largest opportunity for improvements. There's no better time than now to leverage data to optimize performance.
From my perspective, I'm really excited to see how AI is going to be leveraged in the future and how organizations are going to be able to use it to address clinical and operational efficiencies. It's definitely a very exciting field. Every year when we go to RSNA, we find out more information about AI adoption, and really looking forward to that space.
Thanks again to Adam Fairbourn and Gurmeet Bawa for joining us and sharing their insights. And to our listeners, if you're navigating capital decisions, imaging is no longer just a line item. It's a strategic investment that touches every corner of care delivery. Until next time, I'm Andrew Rebhan, and this is The Capital Compass, the podcast to help navigate your journey to value.